join the chorus thanking Senator Savino for her dogged efforts to bring this home, and all of my colleagues for a debate and a discussion today that really is patient-centered and really is about balancing what is a complicated and difficult issue, partially because of the point Senator Libous made so movingly. It's not a cure, and we need to be very clear about that. And I think most folks have tried to be. The point that Senator Hannan made that we would be better off with an FDA process. We don't have an FDA process, and we're not likely to get a full one from the federal government anytime soon, and too many people are suffering too much in the meantime. The federal government has done some research on this, though, and none of it is inconsistent with anything that we've heard today. I also think the point about concern and focus on side effects is an important one to consider, but that really has to be considered in the context of medications and of the kinds of serious and debilitating suffering that the people with us today and so many others around the state are experiencing. And I think we all know that among currently legal, heavily prescribed, and generally considered non-controversial medications, the side effects and the impacts today are enormous. That's true especially with anti-seizure medication, not just the kind of first-generation stuff that I've seen my own family members become seriously withdrawn on, but even some of what we're seeing today and a lot of what is prescribed for children. I also think it's critical that we think about the kind of abuse that we see among these generally non-controversial and widely prescribed medications, like opioids on the market, Vicodin and OxyContin and oxycodone, which are abused by more than 5 million Americans, lead to the kind of addiction that we've discussed on this floor, that Senator Boyle's commission and task force on heroin saw a linkage with some of the impacts and the devastation of heroin in communities across the state. Depressants, Valium and Xanax and others, they're abused by more than 2.5 million Americans who become addicted to them. Even stimulants, people forget, but Ritalin and Adderall, prescribed in heavy, heavy, heavy doses to lots and lots of kids, have addictive properties and really very similar to, essentially, marketed versions of speed in many cases, certainly the first generations of those drugs. And I think in each one of these cases, there's a balance to be struck between the needs of patients who are suffering and are struggling, and I wouldn't question any individual parent's decision around any of those generally non-controversial and widely prescribed medications. And I think that in that context, if you look at the medical marijuana proposal before us, and you look at the impact in 22 other states, it really is a no-brainer that this should be available to folks. We have a whole lot of knowledge on it, despite the FDA's failure. We have knowledge because of the other states that have had it for, I guess, 16 years now. We have knowledge because there has been a great deal of research in situations where it's been widely used and not approved to be used. I do think that it's critical that we stay on the patient-centered focus on this and not get into what I do think is part of the issue and part of the reason that this fight has gone on so long. And this does feel so difficult and seems so controversial relative to those other prescription medications I discussed, which is the way that we've framed for a long time the war on drugs or what drug addiction is. Now, I have to say, in a bipartisan way in this House and in this legislature, this year we've moved past that. That task force on heroin and the conclusion of it and the laws that we passed earlier this week, we heard people on both sides of the aisle say, we need to deal with addiction as an illness and we need to solve it. We don't want to criminalize addicts. we need to control access and make sure that those who are providing access inappropriately, who are targeting kids and vulnerable people in communities, need to be punished. We're actually moving towards a consensus on those issues. And I do think that the historical conversation on these issues of illegal drugs makes it that much harder for some to swallow this proposal. But when you unpack it a little bit, this proposal appropriately and carefully controls access, identifies a way to figure out and avoid side effects, and is not the first foray into an unknown and severe medication, but an appropriate next step as we try to separate out some of the rhetoric that has become overheated and led to all kinds of consequences on both the medical side and the criminal justice side for a long time, and move to a place where we really are, as I think everyone on both sides of this debate has been today, truly patient-centered when it comes to conversations about what medications and what drugs, because medications are drugs, folks are being prescribed to help cure them, and in the absence of curing them, as in this case, to help provide a little relief from the kind of suffering that none of us want to see any of our loved ones or any of our constituents or anyone in this state have to endure. So I thank Senator Savino and all my colleagues for the debate today and for the opportunity to move this conversation forward for those who most need it. Thank you, Mr. President.